Hello and welcome to Mental Health Matters. I'm Edgar Wiggins, your host for this program that is dedicated to providing you with practical and useful information regarding mental health issues and needs. Untreated depression can be a debilitating illness that affects millions of Americans each year. Here to help us understand this significant concern is Dr. Annelle Primm, who is the Director of Minority and National Affairs for the American Psychiatric Association. Dr. Primm is a board-certified psychiatrist who's been practicing for over 25 years. Hello and welcome to Mental Health Matters, Dr. Primm.
Hello, Edgar. Thank you for having me.
First of all, so our viewers can understand the extent of this problem, when we talk about depression, exactly what are we talking about? I mean, we all have periods of just kind of not feeling ourselves and being down, but that's not what we're talking about when we're talking about clinical depression, are we?
Correct. Depression is a medical illness that affects how we think, it affects our mood, and even affects how we function. So it's a real illness and not just a passing matter.
Okay. When you talk about depression as an illness, can you give us a sense of how many people in this country it affects?
Somewhere between 15 and 19 million people will have some sort of depression. There are different types. There's major depression, there's dysthymic disorder, and other types of depression where people have symptoms but they're not as severe as the major types. But at any given point in time, close to 20 million people are suffering.
That's quite significant. Now, one of the things that we also are aware of is that when we think about mental illnesses and getting treatment for mental illnesses, the minority population in this country often lags behind in terms of seeking help.
That's correct, and we believe that one of the reasons for that is the great stigma that is associated with having a mental illness among people of color. As you know, in our society, people of color really bear the brunt of many burdens. They're often discriminated against and treated poorly. And so to take on another label of having a mental illness, even like depression, is something that you could understand that they might not want to do, to have sort of two strikes against them, if you will. Other issues that get in the way of people of color not seeking mental health services is very often they will seek alternative sources of help for problems like depression. They may go to the spiritual community to see their pastor or religious leader. They might go to their family or friends, often because of the lack of trust that they have in the health and the mental health system, given some of the historical realities of what life has been like for many members of these groups.
But if you're saying that, in fact, depression is a real medical illness, how is going to your pastor or family or friends for support, how is that going to impact this real medical illness?
Well, it really doesn't impact that real medical illness unless the people that you turn to are informed about it, which is why it's so important for us to mount public education efforts like this about depression so that people in society, pastors, other religious leaders, family, friends, co-workers, etc., can be aware of it, and so they can encourage people to go beyond sort of their natural supports around them to seeking some sort of health care, whether that be from a primary care physician, someone's family physician, or if they would consider it, seeking help from what we call the specialty mental health sector, psychiatrists, psychologists, and so forth.
Well, when we think about depression in this way, I mean, what would be some of the symptoms? What would be some of the warning signs? What would be some of the things that family members or friends or even somebody that's not feeling well, what might they look for?
Well, a person would look for sort of a list of 9 different symptoms and having, experiencing them most of the day, every day for a 2-week period or greater. Symptoms like sad mood or depressed mood, sometimes anxiety as well, or irritability, which sometimes is sort of a proxy for depression and sadness. In addition, loss of interest in activities, perhaps withdrawing from social contact, change in sleep or appetite, either up or down, and we know that people with depression may experience insomnia, or they may oversleep quite a bit. They may have a reduced appetite and lose weight, or they may have an increased appetite and overeat. In addition, having lack of energy, having difficulty concentrating, having low self-esteem, and in fact to the point of feeling very guilty and blaming oneself for things, and having thoughts of death or suicide, which is one of the symptoms that can make depression a potentially lethal condition.
Well, the list of symptoms that you just listed, I mean, some of them are in fact paradoxical. You don't sleep enough, you sleep too much. You eat too much, you don't eat enough. You lose weight, you gain weight. I mean, it really seems to me that in terms of being able to come up with an accurate diagnosis so you can have the appropriate treatment, that you really do need a qualified healthcare professional to make that determination.
Well, you do, because this illness represents a change from the person's baseline or normal functioning. So in addition to having a healthcare professional who will try to get that information from the person, they also can benefit from having information from family members, co-workers, other people who know the individual well, who can tell you how they have changed, because it's not uncommon that a person with this illness doesn't really realize what's going on and may be in denial about it. So, having people who know the person is very important. And actually there's some screening tools available now. For instance, the PHQ-9, or Patient Health Questionnaire, which is 9 items on it, very short, actually can give you a diagnosis, and the questions that are a part of this screening tool match almost exactly with the 9 symptoms that I talked about earlier. So there are ways that even a layperson, could give this screening tool to someone who they think might be depressed and score it and get a sense of whether that person has depression or not, and whether they need medical attention right away.
Well, let me ask you another question, because you talked about family and friends. Is depression an illness that runs in families?
Yes, it does. Like many illnesses, it's very common for relatives, biological relatives of the person, whether that be a sibling, a parent, grandparent, aunt, uncle, to have also had it. And if one of your relatives has had depression, it does not guarantee that you will experience it, but it certainly increases your risk and makes you more vulnerable. And we know that certain stressors in a person's life can bring out the depression, and doesn't necessarily cause it, but if a person is vulnerable due to family history, it can increase your risk.
So we are talking about an illness then that has a genetic predisposition.
Yes.
If a relative had it, there's a chance that under certain stressful circumstances, life stressful circumstances, that you may in fact have an episode of depression.
Yes.
But on the other hand, we're not talking about what we used to think or what people you see often in the movies and on TV, that something stressful or traumatic happened to someone and that's why they're depressed. It's not that kind of relationship.
For the most part, no, because if we think about it, everyone goes through stressful situations on a regular basis, and not everyone experiences depression. So there's something in individuals who have the illness that makes them more vulnerable than, the average person.
Now, my next question is whether or not, because I think this is also important, there is in fact something that happens to chemicals in the brain. There's some brain involvement, something called serotonin. Can you talk about that for just a minute?
Yes, there are a number of chemical messengers in the brain, some of which are responsible for helping to maintain normal mood. And some of them include serotonin, as you mentioned, norepinephrine, which used to be called adrenaline, which people are familiar with. That's another one that's been involved with mood. And also dopamine is another chemical messenger. And actually, these are the neurochemicals upon which many of the medication treatments are based, to make more of them available in the brain so that the person can have their normal mood restored.
So essentially then what the drugs do when they work is to help regulate these chemicals in the brain.
Yes.
Okay. So why is it then, if we have treatments that work and are available, that often minority individuals are not willing to come forward to avail themselves of these treatments?
Well, besides the stigma, also just the trust issue. Very often people of color feel that they're not going to get a fair shake when they come in for treatment, that they're going to be mistreated. And there are a number of polls which actually bear that out, that they feel that they are talked down to in healthcare situations. And so it's not surprising that they would seek other means with individuals who they feel more comfortable with. Sometimes the communication from the physician or the healthcare provider leaves something to be desired. Maybe there's a lack of understanding about some of the cultural issues that may come into play with depression, some insensitivity there, or even some stereotypes and bias that come into play. So these are some of the things that we're beginning to understand, some of the differences in outcome that people of color experience when they do get treatment.
Okay.
And so there's still more work to be done to make sure that people of all backgrounds get high quality care when they finally do get in that door for treatment.
All right. And we're going to explore this further, but right now we have to take a break. We'll be right back.
I am a walking, talking miracle.
I am here because I survived leukemia,
lymphoma, Hodgkin's disease, myeloma.
I'm here because of my strength,
my faith,
my treatments.
I'm here because of you.
Thanks to support for the Leukemia and Lymphoma Society, the survival rate for these cancers has nearly doubled in the last 40 years. Please help us keep the research going. Call 1-888-HELP-LLS.
I am a walking, talking miracle.
I am here because of you.
If all the drunk drivers arrested in Maryland during the past 3 years were here today, this stadium would be full. If you drink, drink responsibly. Remember, drunk driving, it's not worth the penalty.
Welcome back to Mental Health Matters. We're joined today by Dr. Annelle Primm, who is a board-certified practicing psychiatrist and the director of the Office of Minority and National Affairs